Welcome to the CF Foundation's Care Center Town Hall on keeping unvaccinated kids safe. My name is Jeffrey Harden, and I am a Senior Development Director with the CF Foundation's Delaware Valley Chapter Philadelphia office. And I'm thrilled that you could join us tonight, and also welcome to those that are watching this recording after the fact. We know that this is a very stressful and difficult topic, and so we wanted to just give you the best information to help you make choices and navigate these concerns. And we're pleased that with us to help you navigate this is Dr. Laurie Varlotta from St. Christopher's Hospital for Children. She's going to share a presentation just giving you some background on COVID-19 and some particulars to the cystic fibrosis community. And then we will either open up for questions or direct you to your care center for more information. With that, I'd like to turn it over to Laurie. Thank you so much.
Thank you, Jeffrey, and welcome everyone. Let me start sharing my slides. This is a topic that I think everyone is wanting to understand and learn a little bit more about, and so I'm here to give you some of that information. So my presentation is taking its time loading. So we all know that about the coronavirus. We all know about this novel, or what people call also SARS-CoV-2, and now it's having trouble loading my presentation.
I see it.
Oh, it's up?
Yep.
Oh, that's interesting. So is it up now?
Mm-hmm.
Still? Okay. Interesting, because I can't stop seeing. So let me know if there becomes a glitch again, and I would be glad to reload them again. So just to go over a little bit about the coronavirus, everybody's seen this slide before. This is on the Pennsylvania Department of Health's website, and that's a picture of the coronavirus, and I know everybody's seen that. But let me take you through and tell you a little bit more about what's going on today as opposed to when we first started about 1.5 years ago. Viruses love to stay alive, and the way they do that is very similar to bacteria and developing resistance. Bacteria sometimes change and morph and develop more resistance, and viruses do that too, and we tend to call that they mutate. And right now we're lucky that we still have a vaccine that works against the virus, but this will keep mutating as time goes on and get harder and harder for us to deal with. So it's important for us to try and do as much as we can now to prevent spread, to prevent illness. So right now, the Delta variant, as we know, spreads more easily than other variants that we've seen before. And so instead of the original variant, COVID strain, maybe infecting 2 people, now with the Delta variant, it will infect anywhere from 5 to 6 people or even more. It also, we know that it stays around a little bit longer too. So the Delta variant also has a different, what we call incubation period. And the incubation period is how long it's in your body before you have symptoms. And this is the time that during this incubation period when you are contagious. So in non-vaccinated people, this is where we have seen that 96% of the hospitalizations and death across the country are due to the Delta variant, but mainly in non-vaccinated people. So the way the disease presents, it's pretty much the same as the Alpha variant, and it's very similar to the flu. You'll get cough, fever, chills, shortness of breath, fatigue, muscle, body aches, headache, loss of taste or smell, and that's pretty sort of standard in a sense for the coronavirus, sore throat, runny nose or congestion, nausea, vomiting, or diarrhea. So again, it's similar to what we saw before. There is a little bit of a difference between pediatric and adults. In pediatrics, most are asymptomatic, meaning they have no symptoms at all, or they have very mild symptoms. And it's usually consists of a fever, but a low grade. It doesn't have to be very high and just for a day or so, and nasal symptoms. But there's something very specific about the coronavirus in pediatrics, and it sometimes comes a few weeks even after you've actually been infected or the kid has been infected. And this has been labeled the MIS-C. It's multi-system inflammatory syndrome, where you have high fever that is persistent for days, a rash that really is throughout the whole body, and it's a very sort of odd looking rash. And there's a lot of inflammation, and this inflammation actually is within every part of their body. Adults, I just went over a lot of the symptoms, but again, it can be very variable. There are some people that just have GI symptoms, vomiting, diarrhea. There are others that just get some fever, and there are others that are actually get pretty sick. We see, again, like I said, it's more of a mild case in vaccinated individuals, and really hospitalization and death is seen in the unvaccinated. Also, I want to go over the CF Foundation through their registry have collected data from the beginning of when the pandemic started. And this is back in a year ago, 2020, September 24th, where at that time we had 240 known cases or confirmed cases that were recorded in the registry. And then of these, 76 were pediatric, 53 patients were hospitalized, and only 12 were pediatric. And patients with what we call advanced lung disease, which is defined as being on oxygen or having a lung function of less than 40%. And that's that FEV1 that if your child is old enough to do what we call PFTs or spirometry. So only 27 people, and not only, but 27 individuals with advanced lung disease were hospitalized with COVID, one who actually died, and 13 patients with lung transplantation, and again, one death. So not seen as dramatically in the CF population as in the general population. So that's actually some good news. In this year, and actually it's exactly a year later that more data came out, September 24th, and we get some of this information even weekly. We have approximately 30,000 people in the US Foundation Registry Data Bank, and you can see that now we have a lot more robust data. Some of the problems with before is we didn't have enough in the way of testing equipment, things like that to test for COVID. So now we're in a much better place to give you a little bit more of an idea of what's going on, but you can actually see that there's quite a jump in the number of confirmed cases. So before there were only 240 recorded cases, now there are over 1,800. Again, of these positive cases, 589 are pediatric. We have 280, 51 of those being pediatric patients that were hospitalized, 116 with advanced lung disease, and 129 with lung transplantation that actually became positive. So approximately 20% of patients with the infection are hospitalized who have CF, but only about 4% of those are pediatric. So again, most of the individuals with advanced lung disease or lung transplantations pick up the bulk of the hospitalized individuals. Also, we started the CF Foundation started with their registry. All the CF centers have to input whether or not an individual has been vaccinated and with what vaccine. So that actually is being tracked. And again, looking at 30,000 individuals total. But if you look at the total number of vaccinations, the eligible number of these individuals is 21,850 who are going to be 16 and older that can actually get the Pfizer vaccine at this point. So total number of vaccinations is 8,000 out of the 21,000, so only 35%. And of ages 12 to 16, because now we know that Pfizer has lowered the age limit, we have 687 out of an eligible 3,274. So just shy of 20% of individuals with cystic fibrosis in those age groups now are vaccinated. So we're a little concerned about that, and we'd like that to be a whole lot higher because we don't know if new variants are going to be coming and what that will look like and how that will affect different people, and including kids. This is actually also from the Foundation Registry data, and you can see it's by quarters from the first quarter, meaning January to March of 2020, all the way through to, and this is not complete because it's a week or so old, a week or so before the end of the third quarter, 2021. So you can see initially, the graph again shows that 73% in the first quarter of 2020, and then even in the second quarter of 2020, you can see it's 72, 73% of the individuals were adults. During the past 2 quarters, the percentage of cases occurring in children has grown quite a bit and is almost equal now to the adult cases. And again, we're not sure what will happen if this virus mutates or changes again. This is actually a slide that my CEO, Don Mueller, put up, and that is him because it was a Zoom conference again. And that's him saying vaccines are safe, but he is part of a children's consortium across the country, and they have been tracking child COVID cases by region. And you can see the different quarters, but what I want you to focus on, and the one that he's covering up with his picture, is the West. So Northeast, where the blue, the green, I want you to focus on the South, because right at where the red arrow is the start of school for the South. And then within a month, there's a spike in cases. So we're just about at that point. So we're worried that there will be a spike in cases. Now, there is a little bit difference in our area with other types of preventions that we put in place, but it's important to note. So this is concerning to all of us. So how can you stay safe, and how can you keep your children safe, especially if they're unvaccinated? It's what we call layered prevention, and this is really the key. And if you think about it, this has been what the CF Foundation has been doing for years with our infection prevention guidelines. We have been adhering to a lot of what now the rest of the country has to do, and we'll go over them. First and foremost is vaccination, and a lot of your children, if they're not at the age that they can be vaccinated, that is a problem. But everybody else that they're around should be vaccinated, because that's really the way that you're going to stay safe and stay the safest. What we also know about vaccination is that even if you get it and you've been vaccinated, you're going to not hold it and be able to give it to others. That time period is much shorter than if you're unvaccinated by quite a number of days. So you may only shed it or spread it for 2-3 days. If you're vaccinated, you can spread it for 14, 21, and sometimes longer if you're unvaccinated. So vaccination is actually going to be some of the key to getting a lot of this under control. Hand washing, hand sanitizers, these are things that we have been doing all along. But again, these are the different layers of protection. Masks. I know at St. Christopher's, we ask our families and our kids to come in wearing a mask to keep themselves safe. And this is to prevent them from getting anything or even transmitting something to somebody else. So it really does work both ways. But really the important thing is masks can protect them, okay? And if people have questions about that, you can ask after, obviously, or ask your CF care centers. Social distancing, we do the 6 feet apart. We've done that for a long time, and we've been advocating for that. And again, these are all part of the things that we as a community do, but now the rest of the country has to sort of grapple with. Outdoor activities. We have moved a lot of our social events that are being done, like stair climb, great strides walks, they're all outdoors. So that spreads people out. And that's, again, a same type of measure that we can do here. So the CF Foundation has stated that really only one person with cystic fibrosis should be in a room at a time at different functions. So again, knowing that outdoor activities are going to be much safer. It's important to understand what vaccines are supposed to do. And vaccines are meant, all vaccines across the board are meant to prevent serious illness, hospitalization, and death. That's really the goal of any vaccine that's developed. And you have to remember these vaccines, we think of them as new, but the technology has been around for 20 years plus. So it became the right moment to use this type of vaccine type to create the vaccines that we have for COVID. Vaccines are meant to give you a little bit of the sample of what a virus is going to be like to your body. So yes, you can react to it. Yes, you may get symptoms, but remember, they would be much, much worse if you actually got the true infection. So vaccines, these are safe. They're very effective, as we've heard. And the Pfizer vaccine is now for ages 12 and up. And hopefully we will have more information regarding, sorry, it's actually, this is wrong. It's, yeah, so my apologies, but we'll hopefully be able to get a little bit more information about the 6 to 11 group in the very near future. Moderna, 18 and up, Johnson & Johnson, 18 and up. So also what I want to just mention here are boosters, and I'm going to have a link later on that gives information what the CDC guidelines are about boosters. So just more to come on that. Going back to school, going back to what we call these sort of normal activities or the new normal, mass mandates versus masks being optional versus mask banned. And this is a hot topic. It really is. But involve your CF center for any of the things that you have or any of the questions that you have. And you also need to think about not just school, but any activities outside the home. So we talk about keeping your unvaccinated kids safe, but it's also trying to think about not just school, but everything, because you have clubs, you have theater, you have soccer after, you have your local soccer team versus your school soccer team. And this is going to be a very active process. But getting back to masks, no matter what policy the school has, your child should be wearing a mask at school. And this can be then something that is a letter that comes from your CF center, put in your 504 plan, things like that. But those are the different things that are going to help and going to advocate for your child. Know your school district's policies and the options. There are some schools that actually are not giving virtual learning as an option. And I've even written letters to say, hey, let them be virtual until, because maybe it's one of those that are banning masks, things like that. But let them be virtual until they can get vaccinated and be safer. Know the environment in your class, in the classroom that your child is in. Talk to the teacher. Again, empower yourself and your child to really try and keep them as safe as you can. I talked about an IEP or 504 plan. Really put that in place, because that will help to advocate for your child in school. And we talk about school and the younger and unvaccinated, but you might have a child that went to college and worried about them. Register them with the Office of Disability. Put in place certain things that will protect your child. And again, involve us if you need. Also know things can change. The school and the school district, a few schools in Philadelphia have closed because they put a cutoff of greater than 3% of students or faculty. If they test positive, they're going to become virtual until that flare sort of calms down. So know the school, know what your school policy and the local district, what they're going to be doing to keep things safe. Know your area, your state. Have a backup plan, because this is going to be very important, because we know things are going to change. So we just have to be ready for it. And we can be a little bit more prepared than last year. Again, we have to think about all activities, and not just in the school, in the home, outside the home, other activities. And with Halloween just around the corners and then the rest of the holidays quick on its heels, this can be a very challenging time, and it can be a very emotional time too. Children that can't be vaccinated, again, can carry the virus and bring it to others. So you may need to take that into account for you and your child's health. So know the vaccination status of family members if you're going to a holiday party. Know the size of the gathering, indoors versus outdoors. How to travel. What's the best way to get there? Plane versus a train versus a car. So these are the different things to think about. This is actually going to be, it's on the cff.org website under COVID, and it's a risk assessment tool. And it takes two key factors into account when trying to figure out your risk of contracting COVID-19. And that's the length of time and the type of contact. So on the what we call the y-axis, or horizontally, you have your risk based on the type of contact. Vertically, or what we call the x-axis, is the risk based on length of contact. You can see in the lower left-hand corner, you can see a very low risk. And the lighter it is, the less risk there is. And as you go diagonally up to the upper right-hand corner, you can see it becomes a very high risk. So based on the type of contact and based also on the vaccination of the people within the group that you're seeing. So this is going to be a really important and a very good tool for you to use to try and just help you and identify the different areas that might be less risk for you and your family. Other things to think about: keep all your appointments. That's going to be really important. Don't slack off. Sometimes, whether it's telemed or whether it's an in-person visit, we'll try and make it as safe as possible. Flu shots. This is the time of year that you should get the flu shots, and flu shots can be given with the COVID vaccine or around the same time. So don't worry about that. Okay, so, but get your flu shot and protect yourself from that. We're having a very hard time trying to figure out what might be other viruses versus the coronavirus, because again, like I said, they could be very similar. Some different areas to go to, and these are my go-to guides also. It's the CDC and CFF. So cff.org has the discussion guide, and they also have a different section with specific to coronavirus. So, and this is where you have a lot of resources, including a question and answer page. And I'll show you some of those. So here's a snapshot of the CDC and talking about the Delta variant and what you can do. And all these links that are on the bottom, you'll be able to get, we can send it out as a link. Jeffrey can send it out after this talk. Or also you'll be able to, in the recording, get them. So the cdc.gov website has very good information about the Delta variant. It also has good information about what happens if somebody gets COVID in the home. I've already had that where I've had a couple of families call me that one of the other kids in the house now tested positive for COVID, and what do we do? And they were just playing video games together and this and that. So there's a lot of good advice and guidance out there. So the CDC has this on their website. So very good information. Unfortunately, by the time, again, like I said, once you find out that one kid in the family has COVID, they've probably been in contact with the other kids or you in the family. Also, this is something that's very important that I found on the CDC website, and this also talks about boosters too, but they specifically talk about cystic fibrosis on the CDC website and what you can do, and that you are considered to be increased risk for severe disease. So again, this is not something to be taken lightly. Even though we don't see grave numbers of people getting and being hospitalized or dying from COVID with cystic fibrosis. So again, something very important to look at. They have information about boosters on here too for anyone that wants to know. This is the website, cff.org. And this is the new website, the updated one. And so they're closely monitoring the pandemic and how it affects individuals with CF and their families. So again, this is a great way, and it's under Life with CF, under Daily Life. And again, the link is here. So you click on this link and it will take you directly to the site. And if you scroll down that page, then you get to where there's question and answers and what you need to know about different vaccines, and actually even how to find where you can get the vaccine. These are all the different websites that I had listed on those slides in one little easy area to find everything. So I wanted to thank you for your time, and I hope this has been helpful information for you and your family. And please let us know if there's anything we can do, or if you have any questions, we would be happy to answer them. Thank you.
Thank you so much, Dr. Varlotta. That was terrific
Get
information. And I hope that you stay safe as well. I'm getting a little echo, sorry about that. But we wanted to just conclude by encouraging you, as Dr. Varlotta said, if you have any further questions, please reach out to your CF Care Center. They are there to help you navigate this. Thank you again, Laurie, we appreciate you joining us tonight. Thanks everyone for watching, and I hope that you all stay safe this fall. Take Take care.
Bye-bye.